The C-SPAN networks bring you long-form public affairs programming from the nation's capital and are a public service of your television provider. C-SPAN, created by cable.
Roger Runningen. Roger's, it's his birthday, by the way. So that's not the reason you got a question, but I thought it was important to note that. Happy birthday.
Back to health care. Can you guarantee for the American people that the health care website is going to be fully operational for all people, not just majority, by November 30? And second, more broadly, this is your signature domestic piece of legislation.
Right.
You hear criticism on the Hill that you and your White House team are too insular. Is that how this mess came to be?
Well, I think there's going to be a lot of evaluation of how we got to this point, and I assure you that I've been asking a lot of questions about that. The truth is that this is, number one, very complicated. The website itself is doing a lot of stuff. There aren't a lot of websites out there that have to help people compare their possible insurance options, verify income to find out what kind of tax credits they might get, communicate with those insurance companies so that they can purchase, make sure that all of it's verified, right? So there's just a bunch of pieces to it that made it challenging. And you combine that with the fact that the federal government does a lot of things really well. One of the things it does not do well is information technology procurement. This is kind of a systematic problem that we have across the board. And it is not surprising then that there were going to be some problems. Now, I think we have to ask ourselves some hard questions inside the White House as opposed to why we didn't see more of these problems coming earlier on. A, so we could set expectations. B, so that we could look for different ways for people to end up applying. So, ultimately, you're right. This is something that's really important to me, and it's really important to millions of Americans who have been waiting for a really long time to try to get health care because they don't have it. And I am very frustrated, but I'm also somebody who, if I fumble the ball, I'm going to wait until I get the next play, and then I'm going to try to run as hard as I can and do right by the team. So, ultimately, I'm the head of this team. We did fumble the ball on it, and what I'm going to do is make sure that we get it fixed. In terms of what happens on November 30th or December 1st, I think it's fair to say that the improvement will be marked and noticeable. The website will work much better on November 30th, December 1st, than it worked certainly on October 1st. That's a pretty low bar. It'll be working a lot better than it was last week, and will be working better than it was this week, which means that the majority of people who go to the website will see a website that is working the way it's supposed to. I think it is not possible for me to guarantee that 100% of the people 100% of the time going on this website will have a perfectly seamless, smooth experience. We're going to have to continue to improve it even after November 30th, December 1st. But the majority of people who use it will be able to see it operate the way it was supposed to. One thing that we've discovered, though, that I think is worth noting, a lot of focus has been on the website and the technology. And that's partly because that's how we initially identified it. These are glitches. What we're discovering is that part of the problem has been technology, hardware and software, and that's being upgraded. But even if we get the hardware and software working exactly the way it's supposed to, with relatively minor glitches. What we're also discovering is that insurance is complicated to buy. And another mistake that we made, I think, was underestimating the difficulties of people purchasing insurance online and shopping for a lot of options with a lot of costs and a lot of different benefits and plans, and somehow expecting that that would be very smooth. And then they've also got to try to apply for tax credits on the website. So what we're doing, even as we're trying to solve the technical problems, is also what can we do to make the application a little bit simpler? What can we do to make it in English as opposed to bureaucratese? Are there steps that we can skip while still getting the core information that people need? And part of what we're realizing is that there are going to be a certain portion of people who are just going to need more help and more hand-holding in the application process. And so I guess part of the continuous improvement that I'm looking at is not just a technical issue. It's also, can we streamline the application process? What are we doing to give people more assistance in the application process? How do the call centers and the people who are helping folks in person, how are they trained so that things can go more smoothly? Because the bottom line ultimately is I just want people to know what their options are in a clear way. Buying health insurance is never going to be like buying a song on iTunes. It's just a much more complicated transaction. But I think we can continue to make it better. All of which is to say that on December 1st, November 30th, it will be a lot better. But there will still be some problems. Some of those will not be because of technological problems, although I'm sure that there will still be some glitches that have to be smoothed out. Some of it's going to be how are we making this application process more user-friendly for folks. And one good example of this, by the way, just to use an analogy, when we came into office, we heard a lot of complaints about the financial aid forms that families have to fill out to get federal financial aid. And I actually remember applying for some of that stuff and remember how difficult and confusing it was. And Arnie Duncan over at Education worked with a team to see what we could do to simplify it, and it made a big difference. And that's part of the process that we've got to go through. And in fact, if we can get some focus groups and we sit down with actual users and see how well is this working, what would improve it, what part of it didn't you understand, that all I think is part of what we're going to be working on in the weeks ahead.
What about the insularity criticism that you hear on the Hill?
I've got to say, I meet with an awful lot of folks, and I talk to an awful lot of folks every day. And I have lunches with CEOs and IT venture capitalists and labor leaders and pretty much folks from all walks of life on a whole bunch of topics. And if you looked at my schedule on any given day, we're interacting with a whole lot of people. And I think it's fair to say that we have a pretty good track record of working with folks on technology and IT from our campaign, where both in 2008 and 2012, we did a pretty darn good job on that. So it's not that, the idea that somehow we didn't have access or were interested in people's ideas, I think isn't accurate. What is true is that, as I said before, our IT systems, how we purchase technology in the federal government is cumbersome, complicated, and outdated. And so this isn't a situation where on my campaign I could simply say, who are the best folks out there? Let's get them around a table. Let's figure out what we're doing. and we're just going to continue to improve it and refine it and work on our goals. If you're doing it at the federal government level, you're going through 40 pages of specs and this and that and the other, and there are all kinds of laws involved, and it makes it more difficult. It's part of the reason why chronically federal IT programs are over budget, behind schedule. And one of the, when I do some Monday morning quarterbacking on myself, one of the things that I do recognize is, since I know that the federal government has not been good at this stuff in the past, 2 years ago, as we were thinking about this, we might have done more to make sure that we were breaking the mold on how we were going to be setting this up. But that doesn't help us now. We got to move forward. Jeff Mason.
Thank you, Mr. President.